Most people over the age of 50 think that knee pain while going downstairs means that their joints are worn out. Bone on bone, arthritis, just a part of getting older. And it's that assumption that is actually keeping people stuck exactly where they are. Because in most cases, the pain isn't coming from damage, it's coming from weakness. Your knee doesn't hurt going downstairs because it's broken. It hurts because it's not strong enough to handle that movement quite yet. So in this video, we're going to cover why going downstairs hurts more than going up, why avoiding stairs might be making things worse instead of better, and the exact steps you need to take in order to fix it. Have you ever noticed that because of your knee pain, it sometimes is harder to go down the stairs than it is to go back up the stairs? It's not a coincidence, it's physics. Whenever you go downstairs, your leg, your quadricep muscle on the leg that you're going down with, is actually having to control all of your body weight and your balance to help you get down the stairs. Whenever your muscle is doing that, we call that eccentric loading. Most people blame the joint, but the knee joint is just reporting the news. The thing is, going downstairs is not a knee test. It is a strength test. I'm reminded of a patient that I had in her mid-50s that was starting to have some knee problems and some joint pain, and so she went to her doctor. Her doctor told her to take it easy on stairs. Try to avoid them if at all possible. You have bone-on-bone arthritis in that knee. 3 months later, she was having a hard time just even getting out of her house because she had 4 steps to get out of her house that she needed to go down, and because she had been avoiding the stairs in her home to go up to the 2nd floor and come back down, she wasn't able to even get out of the house now without pain. I remember she told me the main reason why was because she was so afraid, not because of the pain that she was having to go up to the 2nd floor of her home in her knee, but she was afraid of the pain that she was having coming down. She was afraid of falling. Whenever I took a look at exactly what was going on, her knee joint was fine. It moved great. I was able to move it no problem. But whenever we started to really strength test it, we noticed that that was where the problem was. The quad strength on her leg that she was having trouble with was significantly weaker than it was on her non-affected side. So the knee joint was fine, but the muscle supporting that knee joint wasn't doing its job. Pain is the joint doing the work that the muscle should be doing. Here's exactly what's going on with your knee. Whenever we go upstairs, this thing happens in our muscle called the concentric phase of contraction. What that means is that the muscle is actually shortening, so it makes it easier for it to release all of that tension, kind of like a spring, so that you can go up the stairs. Whenever we go downstairs, our muscle has to do the opposite kind of contraction, which is called eccentric. What it's doing is that it is lengthening, but it's still a contraction because it's trying to slow the body down so that you don't just fall uncontrollably down the stairs. Because of this, it's actually harder on your muscle and it requires more effort from your muscle to help slow your body down as you go down the stairs. So basically, every single step that you take going down the stairs is basically the same thing as doing a single leg squat. And if your muscle isn't strong enough to support the load of your body, all of that force just goes straight into your knee joint. And it's something that your knee joint's not able to handle completely on its own right now. And so that's why we end up with pain in the knee whenever we try going downstairs. This goes back to an earlier point that I made in that pain in our knee joint is because the knee joint is having to do all of the work that the muscle, the quadricep, should be doing. Here's where most people make it worse. You hurt, so you avoid stairs. Because you're avoiding stairs, your leg muscle, your quadricep, is not able to get as strong as it needs to handle the load, so that whenever you do it the next time, you end up hurting more. What you're doing is that you're depriving yourself the ability to strengthen up that muscle so that it can handle the load better, so that you can go downstairs without pain. And this take it easy advice accidentally creates the cycle that we get stuck in. And here's the scary part. Avoidance isn't actually rest. It's deconditioning. At the end of the day, if you don't use it, you lose it, and stairs are the thing that is telling you that you've lost it. All right, so we've talked about what's actually going on with stairs. We've talked about the avoidance trap. So what do we do about that now? Here's how we fix it. So the first movement that you're going to do is a step down, the exact same movement that you've been avoiding. What I want you to do is that you're going to stand on a step and you're going to slowly lower yourself on your weaker leg. This is training the exact motion of where it hurts. And the reason why it works is because it's training you in those motions and in that range of motion that you are weak in. To begin with, you want to start this off body weight only. You want to do this for 8 to 10 reps and do this about 2 to 3 times per week. All right, so if movement 1 was step downs, then movement 2 is going to be tried and true sit to stand exercise. What this is doing is that it's helping to train your single leg quad control in the range that stairs demand. So you're gonna start off the exact same way that you would. You're sitting down in the chair, you cross your arms over your chest, and you go to stand up and sit back down. If that's easy, then what you can do is try to slow your descent. So as you go to stand up, you can slowly come and sit back down. And what I've been telling people is once you feel your bottom touch your chair, don't sit all the way down. Once you feel yourself touch the chair with either the back of your legs or with your bottom, you want to go ahead and stand right back up. And here's the thing with both of these exercises right here. We're not looking for pain-free movement in this point. Either way that you do this, you're gonna have a little bit of pain starting off. What we're trying to do is we're chasing control. To close out here, your knees aren't failing you because you're aging. They're sending a signal that a muscle needs training. The people who listen to that signal and do something about it stay independent. The people who avoid that signal don't. If you found this video helpful, I'd appreciate it if you would subscribe and give this video a like and leave a comment down below about something that you learned from this video. If you want to see more content like this, I have a video right over here that I think you might enjoy watching.